A 5 on your health now. The first 2 human cases of West Nile virus this season are now confirmed in Massachusetts. Health officials now warning residents about a potential increase in infections. So here to answer questions is Dr. Daniel Kritzkis, Chief of Infectious Diseases at the Brigham. Dr. Kritzkis, great to have you as always.
Great to be back with you.
All right, Dr. Kritzkis, let's talk about West Nile first. What is it and how does it get spread?
So West Nile is a virus that's an arbovirus because it's spread by mosquitoes, and it is also a neurotropic virus, meaning that it can cause infection of the nervous system.
Okay, so the state's saying mosquito populations, they're, quote, fairly large this year. It's been a wet season. If there are more mosquitoes, does that mean there's more potential for West Nile? That would seem to make sense.
That's exactly right. I mean, the things that we worry about with mosquitoes here are spread of West Nile virus, potentially spread of more serious infections like Eastern equine encephalitis, and in previous years, Zika, although Zika never really made it up to Massachusetts. But those are all mosquito-borne infections that can affect the central nervous system.
So the best protection is obviously prevention, but as you well know, especially in the evenings outside, it can be really hard to avoid mosquito bites. So what is your advice?
Well, people who are older and people who are immunocompromised may be at greater risk for more serious infection. It's important to emphasize that the vast majority of West Nile virus infections are really mild or may even be asymptomatic. We worry about the small percent of people in whom it can cause an encephalitis type picture or a polio type picture as well. So preventing it is really the usual ways of preventing mosquito bites. Wear long sleeves, long pants, spray yourself with bug repellent, and try not to be outdoors when mosquitoes are biting. Empty standing water.
Yeah, very
Good
good.
advice.
Okay, Dr. Kritzkis, thanks as always.
You're very welcome.